Today's training will walk through the Treatment Needs Assessment for 2026 through 2030. The purpose of the TNA is to clearly document what treatment and treatment-related supports exist in your county or counties, identify gaps and barriers, and use both data and community input to inform the treatment services plan. The TNA is not just a reporting requirement. It is intended to guide planning, funding decisions, and system improvements over the next several years. Please note, in addition to this training, you will receive an instructional guide that provides more detailed information related to requirements and expectations. The Needs and Resource Assessment portion of the TNA is organized into 4 steps. Each step builds on the one before it, and together they form the foundation of the Treatment and Support Services Plan. These steps focus on data collection and system description and are due May 15, 2026. This step focuses on community input and must be completed by October 16, 2026. This step results in a formal treatment services plan, which is due November 27, 2026. Throughout this training, we'll be referencing the Keystone SCA. The Keystone SCA is a fictional example that we've used to complete sample materials for demonstration purposes. All Keystone SCA examples and resources can be found in the SCA SharePoint file for your reference. Let's walk through accessing SharePoint together. You may be already familiar with using SharePoint to access your SCA's prevention folder. The treatment folder can be found by following the same steps by clicking on your SCA's folder. Within your SCA's treatment folder, you will find all the templates, tables, and reports needed. This is also where you will submit your completed documents. The Keystone State SCA folder contains full examples of the tables and forms that we walk through in this training. The purpose of Step 1 is to describe what your treatment and support service system looks like today. This includes how your SCA is structured, how services are delivered, and what capacity exists across levels of care. In Table 1, you will describe the structure of your SCA and your service delivery system. This includes whether your SCA is a functional unit, how case management is delivered, how recovery support services are delivered, whether services are directly provided or contracted out. If case management or recovery support services are contracted, you must include the number of contracted providers, a brief description of how those services are carried out on behalf of the SCA. The Keystone SCA is a planning council. They provide direct case management services. The SCA contracts for recovery support services with 3 providers. Here you will identify the number of contracted providers for each of the ASAM levels of care, including which providers are within your catchment area, who serves adolescents, and how many provide services for pregnant women and their dependent children. As you can see, Keystone SCA has identified that there is one outpatient provider that serves adolescents. In addition to Table 1, you will provide a narrative section. This narrative should explain anything important that the table alone does not capture. This may include unique service models, geographic challenges, strengths of your provider network, any service nuances that are important for understanding your system. You may also want to include additional information in the narrative describing coordination of care. This should explain how your SCA works with providers and stakeholders to ensure individuals move appropriately through the continuum of care. In Table 2, you will rate existing assets and resources using a 4-point scale. Rating definitions. 1. Insufficient. Less than 50% of the target population can access services. 2. Partially sufficient. Some services exist, but major gaps remain. 3. Sufficient. Most needs are met with minimal barriers. 4. Exceeds sufficient. Services are timely, equitable, and widely accessible. Using the scale from insufficient to exceeds sufficient, you will evaluate access, capacity, and availability. Keystone State is rated 1 for insufficient for adolescent treatment providers and a 3 for sufficient for clothing banks. In addition to Table 2, you will provide a narrative describing how the SCA interacts with these resources, How these assets support a recovery-oriented system of care, or ROSC. How ROSCs is implemented within your catchment area. After ranking resources, complete a narrative. In Keystone State, a significant gap appears in services related to adolescents, including adolescent treatment providers, community-based support, mental health services for youth, and opportunities for life skills development. Table 3 focuses on how frequently your SCA collaborates with community stakeholders. By prioritizing structured and consistent engagement, we can begin bridging existing gaps, align efforts more strategically, and work toward a more coordinated and responsive system of care for the individuals and families we serve. In the narrative section, describe how engagement occurs, who is involved, how collaboration informs planning and service delivery. The purpose of Step 2 is to identify trends, capacity limits, and barriers using available data. This step prepares you for meaningful community discussions in Step 3. There are 6 reports in total for your SCA, 2 for every year. These reports can be found in SharePoint. You will need them to complete the state comparison and Table 4. Next, you will complete the statewide comparison tool. Input your SCA's numbers into the yellow cells for each tab. The graphs will auto-populate, allowing you to compare your SCA to the state average. To complete Table 4, you will need the following documents: 6 SCA reports, covering years 2021 through 2024, completed Tables 1 through 3, and the Table 4 template. In Table 4, you will use the provided reports and variable list to identify key data trends, emerging issues, and preliminary insights that should be discussed with the community. Begin by locating each indicator. These indicators come directly from the reports you were provided. Next, review the values for each year and summarize the data. Let's look at the Keystone State's explanation of the data for adult admissions. During 2022 to 2023, 48% accounted for opioids and 27% for methamphetamine. In 2023 to 2024, opioids accounted for 53%, while methamphetamine accounted for 18%. Now you will use the data to identify patterns, consistencies, or key observations to interpret what the numbers mean. The Keystone State has identified that opioids accounted for the highest admission by substance across the 2-year time span, indicating a high prevalence of opioid admissions. Here we list possible explanations or contributing factors related to what we are seeing in the data. These are not conclusions, but rather areas worth exploring. This section answers the question, what issues might be contributing to the patterns we see? Keystone State has identified areas that may inform the gap as MO utilization, availability, and accessibility of opioid-specific programs. Using Tables 1, 3, identify any gaps that connect with each indicator to answer the question, what gaps in Tables 1, 3 are directly related to the indicators you are analyzing in Table 4. In Keystone State, it was identified that MOUD provider availability was rated 1 as insufficient. Finally, we will identify gaps that should inform listening sessions. This section answers the question of what do we need to hear directly from the community to understand the underlying causes. Keystone State has identified that they would like to hear more about barriers to accessing services and community needs surrounding treatment options. The full example of the Keystone State Tables 1-4 are available on SharePoint for reference. The goal of Step 3 is to validate data findings and hear directly from the community. You will invite SCA staff, providers, individuals and families with lived experience, community-based organizations, youth services, probation, and other community stakeholders. Every perspective matters. There are no wrong answers. Only information we didn't have before. Stay open. Stay curious. Let the feedback speak for itself. The listening session should cover access and availability, quality of services, recovery supports and wraparound needs, community impact and improvement ideas and innovations. Use the provided checkboxes and open-ended questions to capture feedback accurately. Let's look at an example of a listening session held by the Keystone SCA.
It feels like I am trying to live two lives at once. One where I'm working on my recovery and another where I'm doing everything for my kids. Treatment always seems to land right in the middle of that, and I don't have childcare. I want to be there. I need to be there. But sometimes I literally can't.
I'm caring for my daughter's kids right now. They've been through a lot and there just doesn't seem to be anything for them. No space where they can talk about what is going on.
When I first started treatment, they put me in a group right after the intake. I had no idea what to expect. People were sharing really heavy stuff, and I felt like I had to share even though I was not ready.
I was terrified to show up to the first case management appointment. But the moment I walked through the door, everyone had smiles on their faces. The kind that made me feel like I was not an inconvenience. And my case manager, she never rushed me, explained things step by step. I always felt welcomed.
We want to thank you all for coming tonight. We appreciate your time and the opportunity to hear your experiences.
As feedback is shared, it must also be captured. Complete the form in full and submit it to SharePoint, and keep a copy for your records. The community listening session took place at the Keystone State Public Library. There were 15 attendees. As you can see, treatment providers, individuals with lived experience, and other various stakeholders took part. As you can see, when focusing on what is currently going well, attendees noted feeling welcomed and going at a pace where they did not feel rushed. The Keystone SCA took note of identified barriers, where individuals expressed feeling overwhelmed. They also highlighted gaps surrounding support for families and children, gaps surrounding how trauma is recognized and addressed, and a desire for more coordinated wraparound supported programs. The SCA identified supports that the attendees indicated were of high importance, such as medication-assisted treatment, outpatient therapy, recovery support services, case management, housing assistance, employment and job training, and food security, as well as the supports that attendees indicated were missing, such as inpatient residential therapy and child and family therapy. When focusing on the impact of substances on the community, the SCA notes that attendees highlighted the impact on families and the community, and the need to focus on a coordinated approach that makes treatment accessible and promotes safety and equity. The SCA lists modifications offered by attendees for the treatment system. Programs could build in more structured assistance for parents, such as flexible scheduling, childcare, and family therapy, age-appropriate counseling and emotional support for children, offering evening or weekend sessions, creating family days, or connecting parents with community resources. Person-centered approach where mental health therapy, medication management, and substance use treatment are provided seamlessly. Prioritizing emotional safety by providing one-on-one sessions before group participation, offering trauma-specific therapy, and training staff to recognize and respond to signs of distress could create a more supportive environment. Case management that coordinates housing, employment, transportation, and childcare alongside treatment could support stabilization, making recovery more achievable. Programs that treat the family unit rather than focusing solely on the individual. The treatment and service plan is completed after the initial assessment phases have been finalized. Its purpose is to translate identified needs into a clear, actionable, and measurable plan that guides implementation, coordination, and evaluation of services across systems. This plan builds upon assessment findings by establishing priorities based on identified gaps and needs, defining goals and objectives aligned with those priorities, identifying concrete actions, resources, and partnerships, establishing evaluation metrics to monitor progress and outcomes, and providing a narrative that explains the strategy, collaboration, and anticipated impact. Required components of the treatment and service plan. Each priority area in the plan must include the following elements: priority, goal, objectives, action steps, identified resources, evaluation metrics, and narrative summary. Each component should be completed in a clear, concise, and outcomes-focused manner. The priority should reflect a significant need identified during the assessment process and should be broad enough to encompass multiple strategies while remaining focused on a defined population or issue. An example of an identified priority could be enhancing treatment and support services for adolescents impacted by substance use. The goal should directly align with the stated priority, describe the desired long-term outcome, be population-specific and system-focused. A sample goal related to the identified priority could be to strengthen and expand a coordinated, trauma-informed continuum of early intervention, treatment, and treatment-related supports for adolescents impacted by substance use. Objectives break the goal into specific, actionable areas of focus. Objectives should be measurable and realistic within the planning period. Examples of objectives include increase access to age-appropriate, developmentally responsive substance use treatment and support services for adolescents, enhance family-centered and peer support systems that promote sustained recovery and resilience, improve early identification and referral pathways for adolescents at risk of substance use. Action steps describe what will be done to achieve each objective. These should be concrete, implementation-oriented activities. Examples of action steps include conducting a statewide needs assessment to identify service gaps and geographic disparities in adolescent substance use treatment, expanding universal screening and brief intervention practices in school and community-based settings, developing, supporting, and promoting peer support and mentoring programs for adolescents and families, strengthening referral pathways between schools, behavioral health providers, and community organizations. This section identifies the systems, agencies, and partners required to carry out the action steps. Resources should reflect cross-system collaboration. Examples of resources include schools and school districts, local county departments of health, behavioral health and human services, child welfare and juvenile justice agencies, substance use treatment and recovery support providers, community-based organizations and youth-serving agencies. Evaluation metrics define how progress and effectiveness will be measured. Metrics should align directly with objectives and action steps. Examples include number of adolescents screened for substance use using validated screening tools, utilization rates of adolescent-specific substance use treatment programs, engagement and retention rates in peer support and mentoring programs, results from youth and family satisfaction surveys. The narrative provides a comprehensive explanation of the approach and should clearly articulate the strategy, partnerships, communication methods, and anticipated impact. Examples of the narrative include a description of how the SCA will implement a coordinated, youth-centered approach to addressing adolescent substance use, an explanation of how partnerships across education, healthcare, behavioral health, juvenile justice, and community-based systems will be fostered and maintained. An overview of how the plan will be communicated to stakeholders through community forums, advisory groups, and public-facing materials. A discussion of how expanding access to coordinated, adolescent-focused substance use services is expected to improve health, well-being, and educational outcomes for youth. The narrative should connect the individual components of the plan into a cohesive strategy and clearly demonstrate alignment with assessment findings. In addition to the primary treatment and service plan, a supplemental table must be completed. This table mirrors the structure used in the previous treatment needs assessment and includes identification of evidence-based and promising practices, information on language assistance and accessibility supports, strategies for serving uninsured or underinsured individuals, identification of training needs for providers and systems partners, identification of technical assistance needs, and description of relevant community-based practices and supports. Responses in the supplemental table should be concise, factual, and aligned with the priorities outlined in the treatment and service plan. When completed, the treatment and service plan should clearly demonstrate how assessment findings are being operationalized into a coordinated, measurable, and sustainable strategy for improving outcomes. All components should align with one another and reflect a shared commitment to collaboration, equity, and evidence-informed practice. Following approval, updates will be submitted annually using a provided template. The update schedule is as follows. Update 1, June-November 1st, 2027. Update 2, June-November 1st, 2028. Update 3, June-November 1st, 2029. Update 4, June-November 1st, 2030. The treatment needs assessment is intended to be a living, practical tool. Clear data, honest assessment, and meaningful community engagement are essential to ensuring services meet the needs of individuals and families across the Commonwealth.